I'm Dr. Chris Dougherty. I'm a sports medicine fellowship trained orthopedic surgeon at the Agility Center in Bentonville, Arkansas. Here we're seeing a patient that suffered a posterior horn radial split, ACL tear, and anterior horn radial split. We're going to repair this with our Novostitch Plus device. For the posterior horn, we're coming in from the lateral portal. I placed my first stitch into the radial flap and then into the intact meniscus to secure the limb down. Now we're going to pass into the capsule and back into the radial flap again. We're going to tie these as we do before with standard Weston knots, locked and backed up with alternating half hitches. So once I've secured this down adequately with two simple stitches, I'll pass another and go ahead and tie this down to maintain our meniscal root and meniscus attachment back to the capsule itself. Anteriorly, it's a very difficult pass. We're utilizing a standard lateral portal and not a secondary incision, so we're going to make an incision underneath the meniscus. We're going to invert our Novostitch Plus device so the upper jaw is passing underneath the meniscus. So we're looking on top of our lower jaw. You can see the needle come into the view of the field with the suture preloaded onto the needle. And that's going to push it through the meniscus and down into the upper jaw. So in this case, we simply passed upside down. We're going to pull our suture tails and just tie our knot on the underside of the meniscus. Utilizing a locking knot, we're able to do this and also adequately control our tension so that we can get an anatomic repair of this anterior horn. Utilizing the device from the medial portal and trying to work lateral, we could not get a proper angle and we were bunching the meniscus, so we elected to utilize this technique to give us a better repair. Here we're simply contouring it. I did trim some of the white zone to bring this into a nice stable margin. But you can see we fixed our anterior horn very nicely and our posterior horn tears and preserved a significant amount of this meniscus which would otherwise have been removed.